What if the one thing you are doing to protect your knees is actually the thing making them worse? If you are over 60 and dealing with knee pain, I need you to listen carefully to what I am about to share, because there is a very good chance you are caught in a trap that millions of people fall into. A trap that seems logical, a trap that feels like the right choice, but a trap that may be slowly destroying your knees from the inside out. Here is what typically happens. You start noticing pain in your knees. Maybe it is a dull ache when you climb stairs. Maybe it is stiffness when you stand up after sitting for a while. Maybe it is that grinding sensation that was not there a few years ago. So you do what seems reasonable. You rest. You stop doing activities that hurt. You avoid walking as much. You sit more. You protect your knees by using them less. And at first, this seems to help. The immediate pain may decrease a bit. You feel like you are giving your knees a chance to heal. You think you are being smart by not pushing yourself. But weeks turn into months. Months turn into years. And somehow, your knees feel worse than ever. The pain has not gone away. In fact, it may have spread or intensified. Simple things you used to do without thinking, getting out of a car, walking through a grocery store, climbing a few steps, have become genuinely difficult. You feel like your knees have aged 10 years in the span of 2. What went wrong? The one thing that is making your knee pain worse, the thing I need you to stop doing, is avoiding movement altogether. I know this sounds counterintuitive. When something hurts, our instinct is to rest it. And for certain injuries, rest absolutely is the right approach. If you break a bone or tear a ligament, you need time to heal. But for the kind of chronic knee pain that most adults over 60 experience, the stiffness, the aching, the gradual wear and tear associated with aging joints, complete rest may be one of the worst things you can do. Let me explain why this happens, what is actually going on inside your knee, and what you can do instead starting today. Your knee is an incredible piece of engineering. It is the largest joint in your body, designed to bear your weight, absorb shock, and allow you to walk, run, climb, squat, and move through the world. But like any complex system, it requires maintenance. It requires use. The knee joint is surrounded by muscles, tendons, and ligaments that work together to provide stability and support. The most important of these are the quadriceps muscles on the front of your thigh and the hamstring muscles on the back. When these muscles are strong, they absorb much of the stress that would otherwise go directly into your knee joint. They act like shock absorbers, protecting the cartilage and bones inside. But here is what happens when you stop moving. When you avoid activity to protect your painful knee, those muscles begin to weaken. It happens faster than you might think. Research shows that muscle strength can decline significantly within just a few weeks of reduced activity. For adults over 60 who are already experiencing age-related muscle loss, this decline can be even more rapid. As your quadriceps and hamstrings weaken, they become less able to support your knee. More stress transfers directly to the joint itself. The cartilage, that smooth, slippery tissue that cushions the ends of your bones, has to absorb forces it was never meant to handle alone. And cartilage, unlike muscle, does not have a good blood supply. It cannot heal and regenerate the way other tissues can. So by resting to protect your knee, you may actually be accelerating the very damage you were trying to prevent. This creates a vicious cycle. Pain leads to less movement. Less movement leads to weaker muscles. Weaker muscles lead to more stress on the joint. More stress leads to more damage. More damage leads to more pain. And the cycle continues, getting worse with each rotation. This is the trap. This is what keeps millions of adults over 60 stuck in chronic knee pain that never seems to improve. But there is another reason why movement matters for your knees, and this one might surprise you. The cartilage inside your knee joint does not have its own blood supply. So how does it get the nutrients it needs to stay healthy? The answer is movement. Cartilage is nourished through a process that depends on compression and release, like a sponge being squeezed and released in water. When you move your knee, when you walk or bend or gently exercise, the cartilage gets compressed. This squeezes out waste products. Then when the pressure releases, fresh synovial fluid, the lubricating fluid inside your joint, flows back in, bringing nutrients with it. But if you stop moving, this pumping action stops. The cartilage does not get the nutrients it needs. Waste products accumulate. The tissue becomes less healthy and more vulnerable to breakdown. So rest does not just weaken your muscles. It may also starve your cartilage of the very nutrients it needs to survive. Research has consistently shown that appropriate movement and exercise are among the most effective treatments for knee osteoarthritis, the most common cause of knee pain in adults over 60. Studies have found that people who engage in regular, gentle exercise have less pain, better function, and slower progression of joint damage compared to those who remain sedentary. One major analysis of multiple studies concluded that exercise therapy provides significant benefits for knee pain, comparable to or even exceeding the benefits of many medications, but without the side effects. I want to be very clear about something. I am not telling you to push through severe pain. I am not telling you to ignore your body's signals. And I am definitely not telling you to do high-impact activities that pound your joints. What I am saying is that gentle, appropriate movement is not your enemy. It is your knee's best friend. The goal is to find ways to move that strengthen your muscles and nourish your cartilage without causing additional damage. So what kind of movement am I talking about? Let me share some principles and examples that may help you break the cycle and start rebuilding your knee health. The first principle is to focus on low-impact activities. These are movements that strengthen muscles and improve circulation without putting excessive stress on your joints. Walking on flat, even surfaces is a good starting point for many people. Swimming or water aerobics are excellent because the water supports your body weight while providing resistance. Cycling, either on a stationary bike or a regular bicycle, moves your knee through its range of motion with minimal impact. The second principle is to strengthen the muscles around your knee. This is absolutely essential. Strong quadriceps and hamstrings are your knee's primary defense against pain and damage. One simple exercise you can try is a seated leg extension. Sit in a sturdy chair with your feet flat on the floor. Slowly straighten one leg out in front of you, hold for a few seconds, then slowly lower it back down. Repeat 10 to 15 times, then switch legs. This targets your quadriceps without putting weight on your knee. Another helpful exercise is a wall sit. Stand with your back against a wall. Slowly slide down until your knees are slightly bent. Not a deep squat, just a gentle bend. Hold this position for 10 to 30 seconds, then slide back up. This builds strength in your thighs while your back is supported. A third option is step-ups on a low step. Find a step that is only a few inches high, a stair or a sturdy platform. Step up with one foot, bring the other foot up, then step back down. Repeat 10 times. Then lead with the other leg. This builds functional strength in a movement pattern you use every day. The third principle is to start slowly and progress gradually. If you have been avoiding movement for a long time, your muscles are probably weaker than they used to be. Do not try to do too much too fast. Start with what you can manage comfortably. Maybe that is just 5 minutes of walking. Maybe it is 5 repetitions of an exercise instead of 15. That is perfectly fine. The key is consistency, not intensity. A little bit of movement every day is far more valuable than one intense session followed by a week of rest. Your muscles and joints need regular, repeated signals that they are still needed. Over time, as you get stronger, you can gradually increase the duration and intensity of your activities. But let your body guide you. Some discomfort during exercise is normal, especially when you are just starting. But sharp pain, significant swelling, or pain that lasts for hours after exercise are signs you may have done too much. The fourth principle is to include gentle range of motion movements. Stiff knees become more painful knees. Keeping your joint flexible is important for function and comfort. One simple way to do this is knee bending while lying on your back. Lie down, slide one heel toward your buttock by bending your knee, then slowly straighten it again. Repeat 10 to 15 times on each side. This gently moves your knee through its range without bearing weight. Another option is gentle rocking in a chair. Sit in a chair and slowly rock your lower leg forward and back, letting your knee bend and straighten naturally. This is almost effortless but keeps the joint mobile and encourages synovial fluid circulation. The fifth principle is to listen to your body but do not let fear control you. This is perhaps the most important mindset shift you can make. Many people with knee pain develop what researchers call fear avoidance behavior. They become so afraid of pain that they avoid almost all activity. They catastrophize, imagining the worst possible outcomes from any movement. They become trapped by their own fear. But studies have shown that this fear avoidance pattern is strongly associated with worse outcomes. People who are most afraid of movement tend to have more disability, more pain, and more decline over time, not because their joints are worse, but because their behavior makes everything worse. Your knees are not made of glass. They are designed to move. The goal is to find the right kind of movement, done in the right amount, that helps rather than harms. If you feel some stiffness or mild aching during or after exercise, that is usually normal. Think of it as your knee waking up after a long sleep. But if you feel sharp pain, if your knee swells significantly, if you cannot bear weight, those are signals to stop and consult with a healthcare professional. The path forward is usually somewhere between complete rest and pushing through severe pain. It is the middle ground, gentle, consistent, appropriate movement that respects your limits while gradually expanding them. I also want to mention the importance of body weight in knee health. Every pound of body weight translates to several pounds of force on your knees when you walk or climb stairs. If you're carrying extra weight, even modest weight loss can significantly reduce the stress on your joints. This is not about extreme dieting. It is simply worth knowing that maintaining a healthy weight is one of the most impactful things you can do for your knees. Combined with strengthening exercises, weight management may dramatically change how your knees feel and function. Let me address a question you might be asking. What about medications? What about supplements? What about injections or surgery? Those are all conversations to have with your doctor based on your specific situation. Medications can help manage pain and inflammation. Supplements like glucosamine and chondroitin may help some people, though the research is mixed. Injections like cortisone or hyaluronic acid provide relief for some individuals, and surgery, including knee replacement, can be life-changing when other approaches have failed. But here is what the research consistently shows. Regardless of whatever other treatments you pursue, exercise and movement remain foundational. They are recommended as first-line treatment by virtually every medical organization that issues guidelines on knee osteoarthritis. They are effective, they are safe when done appropriately, and they have no negative side effects. No pill can strengthen your muscles for you. No injection can provide the nutrient pumping that movement gives your cartilage. These are things only you can do for yourself through consistent, gentle activity. I want to take a moment to talk about what this change might actually look like in your daily life. Imagine waking up tomorrow, and instead of immediately sitting down with your coffee, you spend 5 minutes doing gentle leg exercises in your bedroom. Nothing strenuous, just some seated leg extensions, some ankle circles, maybe some gentle knee bends. Imagine that later in the day, instead of driving to a nearby location, you walk there and back, slowly, on flat ground, at whatever pace is comfortable. Imagine that before bed, you lie down and do a few minutes of range of motion movements, keeping your knees mobile and encouraging fluid circulation. Now imagine doing this every day for a month, then 2 months, then 6 months. Your muscles slowly get stronger, your joints stay mobile instead of stiffening up. The cycle of pain and weakness begins to reverse. You may notice that climbing stairs feels a little easier. Getting up from a chair takes less effort. Walking does not tire you out the way it used to. This is not a fantasy. This is what the research shows is possible for most people with knee pain, even people in their 70s, 80s, and beyond. Your body still has an enormous capacity to adapt and improve if you give it the right signals. The change does not happen overnight. It requires patience, it requires consistency, it requires trusting the process even when you do not see immediate results. But the alternative, continuing to rest, continuing to avoid movement, continuing to let your muscles weaken and your joints stiffen, leads only in one direction. And it is not a direction you want to go. Let me summarize what we have covered today. If you are over 60 with knee pain, the one thing that may be making it worse is avoiding movement altogether. Rest feels protective, but for chronic knee pain, it often backfires. When you stop moving, your muscles weaken. Weaker muscles mean more stress on your joint. Your cartilage loses the nutrient flow it needs. Pain increases. Function decreases. The cycle spirals downward. The solution is not to push through severe pain. It is to find gentle, appropriate movement that strengthens muscles, maintains flexibility, and nourishes your cartilage through the pumping action of compression and release. Focus on low-impact activities like walking, swimming, or cycling. Do strengthening exercises for your quadriceps and hamstrings. Start slowly and build up gradually. Include range of motion movements to keep your joints flexible. And work on shifting your mindset from fear avoidance to confident, informed movement. Your knees need you to use them. That is what they were designed for. The worst thing you can do is let them sit idle while they slowly deteriorate. Please remember that this video is for educational purposes only. I am not your doctor and I do not know your specific situation. If you have severe knee problems, a history of knee surgery, rheumatoid arthritis, or other serious conditions, please consult with your physician or a physical therapist before beginning any exercise program. They can evaluate your individual needs and guide you safely. Thank you so much for watching this entire video. If this information was helpful, please hit the like button. It makes a real difference in helping more people find these videos. And if you are not subscribed to this channel, please consider joining. I create content every week for adults over 60 who want to stay active, strong, and independent. Leave a comment below with your age, where you are watching from, and how long you have been dealing with knee pain. What have you tried? What has worked? What has not? I learn so much from your experiences and I read every comment. If you know someone who is struggling with knee pain, someone who has stopped moving because their knees hurt, please share this video with them. This message could change their life. Take good care of your knees. Start moving them today, and I will see you in the next video.